Hello, my name is Sofía, and I'm going to talk to you about the first half of the female reproductive system, which consists of the ovaries, the uterus, and the fallopian tubes. First, I'm going to talk about the ovaries. The ovaries are responsible for the production of oocytes and the production of the female hormones that are estrogen and progesterone. The ovaries are about the size of an almond and they are located in the pelvic cavity. They are divided into the cortex, that is the outer layer, and the medulla, that is the central area. Now, in the cortex there are ovarian follicles formed by oocytes that are surrounded by follicular cells that are later known, when they are developed, as granulosa cells, and they produce estrogen. When this follicle develops, it is later called graphion, and it's the largest now follicle, and it is ready to release the oocyte in the process called ovulation, that is going to be explained later in the fallopian tubes. Okay, so now I'm going to talk about the fallopian tubes that are also known as oviducts or uterine tubes. These are about 10 centimeters long, and it has two ends. One is attached to the uterus and the other one is connected to the fimbriae, which is the place that the oocyte ovulated goes through the ovaries to the uterus in a later process, that is the ovulation. Later, when an ovule and a sperm join, a new term is created, and now it is called a zygote. Moving on, I'm going to talk about the uterus. The uterus is an inverted pear-shaped organ with an average size of 7.5 centimeters long by 5 centimeters wide. It is divided in three parts: the upper zone, where the oviducts are inserted, the center, that is the body of the uterus, and the lower portion, that is the cervix, which extends into the vagina. One of the functions of the uterus is to implant a fertilized ovum in order to allow pregnancy and childbirth. The uterus is divided into the inner layer, that is called the endometrium, and consists of the functional and basal layers. One of the layers in which the endometrium consists of is the functional layer, which develops in the first half of the menstrual cycle. If there is no pregnancy, the layer is removed and it falls during menstruation. Lastly, in the uterus there is also a muscle called myometrium, which is essential during labor since it helps to get the child out of the uterus. And that's it.
The vagina is an organ that acts as an outlet for the menstrual flow, as it also acts as a receptacle for the penis during intercourse. It also constitutes part of the birth canal. It has three parts: the inner layer, which has folds that allow distension, and microbiota that maintains a slightly acid pH. The muscular layer that allows its adaptation to the penis and fetus, and the lower end, which has a thin membrane with abundant blood capillaries called hymen.
The vulva includes the external genitalia, pubic mouth, which is an area where the skin has abundant pubic hair and fatty tissue, the labia majora, which are folds with pubic hair, and sweat and sebaceous glands. The labia minora is similar but without pubic hair. The clitoris is a structure with erectile tissue formed by many blood vessels and nerves. And then we have the vestibule, which includes the area where the urethral and vaginal orifices are located, as well as the outlet of the ducts that form glands that produce the mucus secretion. Mammary glands are even organs responsible for milk production. Milk-producing cells are organized in the structures called alveoli, and several alveoli form lobules, which are joined to form milk ducts or galactophores, which near their outlet are dilatations called lactiferous sinuses.
My name is Alejandra, and I'm going to talk about the menstrual cycle. That is the process where the hormones regulate the maturation of the oocytes, the ovulation, and the process that prepares the uterus for the implantation of it. This process lasts about 28 days and has 4 phases. The first one is called menstrual phase, and this represents the beginning of the menstruation, where the fertilization is absent and the levels of estrogen and progesterone are diminished. Then we have the process of pre-ovulation, in which we change from menstruation to ovulation. In this phase, only one ovary will be in complete maturation and will be ready to ovulate. Then we have the phase of ovulation, in which the peak of estrogen production triggers in the pituitary gland to the production of luteinizing hormone LH, which is the one that promotes the rupture of the mature ovarian follicle and release the oocyte. The last phase is the one that has the name of postovulatory phase, in which the ovarian follicle from which the oocyte was released present a small hemorrhage, and the cells that comprise it are organized, giving an origin to the corpus luteum and beginning to produce progesterone and estrogen.
Hello, my name is Alejandro, and I will talk about the male reproductive system that consists of testicles, the conducts of the male reproductive systems, and the penis. And then I will talk about the diseases. Testicles are scrotal bags at a temperature of 2 to 3 Celsius degrees. This is lower than body temperature. This allows the proper development of a sperm, and in testicles is where the sperm is developed, and that process is called spermatogenesis, which begins at puberty. Well, on the accessory glands, the semen is made up of sperm and secretion of the accessory glands. The secretion of the 2 seminal vesicles contributes 60% of the semen that contains sugar, fructose, that is used as an energy source by the sperm. Since its pH is alkaline, it counteracts the acidic pH of the male urethra and vagina. The volume of the semen during each ejaculation is 2.5 to 5 milliliters and contains 50 to 150 sperm per milliliter. Okay, the penis is the copulatory organ. It has the urethra, which is the road for ejaculation, and the emission of urine, which is an structure formed by erectile tissue that fills with the blood during sexual interaction to maintain the erection of the penis. Okay, now I'm going to talk about the disease sexually transmitted infections. Okay, the first one is the chlamydia. It's by the bacterium Chlamydia trachomatis, and it's an STD, and it manifests as an inflammation of the urethra and accompanied by burning and clear discharge, as well as frequent painful urination. If it's not treated with time, it can cause sterility. The next one is gonorrhea, caused by the bacterium Neisseria gonorrhea. It's highly contagious. It can be infecting during the childbirth, the eyes, and if they become infected, the eyes may suffer blindness. There is an inflammation of the urethra with the production of pus and painful urination, and it can also cause sterility if it's not treated. Syphilis is the Treponema pallidum. This can also be transmitted by blood transfusion from infected donors between the 6 and 24 weeks. Some symptoms can appear like joint muscle pain, rashes, fever. The lack of control of sphincters and muscular weaknesses. If this is not treated, it can cause neurosyphilis, which affects the brain structure, and the patient may even have dementia. Genital herpes is an incurable STD. It's painful blisters on the penis and vulva, including the vagina, and it has nothing to do with herpes type 1 that produces blisters or ulcers on the lips and mouths. The genital warts are caused by the human papilloma virus, which is sexually transmitted and is not curable. And women infected with this virus have more risk to developing cancer in the cervix, and that's the principal mortality causes of women in Mexico. Musculum contagiosum. Yellowish white hard rashes on the skin, exclusively sexually transmitted. It can also occur during childhood and in immunosuppressed people. It's caused by sexual contact. The lesions develop in the genital and perineal areas as well as in tights. The lesion is eliminated with the use of drugs of local application or with the cryotherapy. Acquired immunodeficiency syndrome AIDS. It's caused by the human deficiency virus HIV, and person does not have any symptoms. Its contagion occurs through sexual exposure to semen or vaginal fluids of infected people, and it can be transmitted also by blood transfusion. When a person becomes infected, it may have some symptoms like fever, tiredness, swollen glands and headaches, joints and throat. Some drugs have been developed to improve the quality of life of people infected with HIV. However, the virus can remain dormant even if the laboratory studies do not detect its presence in the blood. Therefore, infected people can still transmit the disease. Hepatitis type B. 5 types of virus produce viral hepatitis. Type B is spread sexually and also by contaminated syringe, blood transfusion, saliva, and tears. This virus can cause liver cirrhosis and liver cancer. For this disease, some vaccines prevent the infection.
Hi, my name is Víctor Rincón, and I'm going to talk about the importance of the contraceptive methods. First of all, contraceptive methods are primarily used to avoid pregnancy. Some of them are also used to avoid diseases. There are several types of contraceptive methods. They divide in physical and chemical methods. The physical methods divide into barrier methods, intrauterine devices, and surgical sterilization. The barrier method's function is to prevent the sperm from entering the vagina or the uterus. They include the condom, the vaginal sac, and the diaphragm. The condom is a latex covering that is placed over the penis when it is erect and before penetration. The vaginal sac is a polyethylene cylinder with 2 rings at its ends. One covers the cervix and the other one covers the sternal genitalia. The diaphragm is a cup-shaped comb that adapts to the cervix. The safety of these methods is variable and depends on their correct use and care. They must not be exposed to heat and take into account the expiration date. The most effective is a condom, followed by the vaginal sac and finally the diaphragm. The condom and the vaginal pouch are useful to avoid infections of sexually transmitted diseases. Then we have the intrauterine devices or IUD. These are objects that are introduced into the uterus and made of various materials such as plastic and metal. These are very safe methods, and each device can be used up to 10 years. The disadvantage they have is that in some women they cause discomfort, bleeding, or expulsion of the IUD. Finally, we have the surgical sterilization. In man, it is called vasectomy. It consists of ligating and cutting the vas deferens of each testicle. In women, this sterilization consists of the ligature and section of both oviducts. This method is the safest. Then we have chemical methods. These divide in hormonal methods. These use hormones that modify the development of the ovarian follicles and inhibit ovulation. They are 100% effective if used correctly. The disadvantage is that a woman could have life-threatening risk factors if she consumes them. The most utilized hormonal methods are oral contraceptives. There are pills that contain synthetic estrogens and substances with similar function to progesterone. There are also the emergency pills or the next day pills. These contain high levels of estrogen and progesterone that inhibit the production of those hormones by the ovaries. The use of these pills reduces the probability of pregnancy up to 75%. Hormonal implants are capsules with progestin that are implanted under the skin and make a slow and continuous release of hormones for 5 years. The skin patches stick on the skin once a week for 3 weeks, skipping the 4th so menstruation can happen. It is essential to change the patch the same day of the week at the same time. The vaginal ring releases estrogen and progestogens. It is placed at the bottom of the vagina for 3 weeks, and in the 4th week it is removed to let menstruation happen. Finally, we have spermicides. These are drugs that kill sperm. They are applied directly or with sponges that are inserted in the bottom of the vagina. It is one of the least recommended methods. It is important to know the characteristics of the contraceptive methods. We have to know which ones are better to our body in order to avoid any risk of pregnancy or getting a disease, so it is very important to use them and also to be informed about them.